Welcome to OnCoffee. Today's episode is extra special for me. My guest is Dr. Aviv Philip Goncharov, a first-year oncology resident at the University Hospital Olomouc in Czech Republic. And also, he's my mentor during my internship here. Philip is originally from Israel and moved to Czech Republic to study medicine and ended up staying for residency. Philip, welcome. I'm so happy you are doing this.
Hi, I'm happy to be here.
So I know you're not a coffee person, like you drink only a cup of coffee daily, but I'll ask anyways, how do you like it?
Well, that's true. And it actually depends on the weather, because when it's hot, I will drink cold coffee, but when it's too cold, I will drink a normal cappuccino. Here I have my shot of espresso.
Cheers.
Cheers.
So yes, I guess it's very difficult to survive the residency life without coffee. I don't know, I started drinking coffee during my medical school years. Like, I guess started from second year. I always drank coffee, like from high school, but it wasn't that much. Like from second year, or from starting from third year, I started to increase the dose of coffee. Like now I'm drinking 3 to 4 cups daily. I guess it's too much.
For me, it would be too much.
Yeah.
I'm more of a tea person.
Yeah, got it. So we got also one guest who also didn't like coffee, and we called that episode OncoTea instead of OnCoffee. So yes. Okay, let's go forward. You made a big decision leaving Israel to study medicine in Czech Republic. What led you to that decision?
Well, in Israel, we have a problem. We have a small amount of medical faculties and a lot of candidates. And that's why not everyone can really be accepted to med school. So a lot of really dedicated people are forced to leave their homeland and move to countries like Czech Republic, Armenia, Lithuania, etc. So I decided to go to the Czech Republic because it's a nice place. They had a really good English program, which was very important for me as well.
I think it's like a big problem for most of the countries. Like in medical schools, like there are limited spaces, limited seats, but most people want to become like doctors. I don't know why. That's the problem for most of the countries. So what was the biggest cultural difference for you in Czech Republic? Like Israel and Czech Republic are definitely like different countries.
Yes, that's true. Czech Republic is more like European cultural, and it's the opposite what is going on in Israel. Also, the language barrier. I had to study the language from scratch, from zero. So it wasn't very easy for me. But at the beginning, just before I started med school, I went to a summer school of Slavic languages, and they taught me the basics of the language. And of course, I have a background of Russian.
Yeah.
So it has some advantage over other students, that's for sure.
Yeah, language is a problem here because I can tell like most of the people do not speak English, and like in hospitals, I haven't met a patient who spoke English. Only one German speaking.
One German, yeah.
All of them are speaking Czech, so it's if you don't know the language, you can work in this environment. So yeah, you have to study Czech, and so like
it also depends on the city. Because Olomouc is a small city, so most of the people here speak just Czech. But if you go to Prague, to Brno, to much larger cities, you will see that even the patients there speak English because it's like more multicultural.
Yeah, but I can tell you, like you master your Czech and like you're speaking really good in Czech. I can't understand. But I guess like your interaction with the patients and everything, like you're doing really great.
Thank you so much.
Philip, you have seen both systems, like healthcare system in Israel and Czech Republic. What are the biggest difference between this healthcare system?
Each system is definitely different. and good in its own way. Each one of them has advantages and disadvantages. I can tell you that in Israel, they really like the innovative stuff. They use a lot of artificial intelligence in their medical practice. It's the high-tech nation, we call it, Israel. Czech Republic is a bit closer. Like they don't like those innovations, although they're also getting there, but they're getting there slowly. But rather than that, both are quite good. In the Czech Republic, for example, you can get a term, like an appointment to CT scan, to MRI, really fast. And in Israel, you have to wait sometimes for months, which is not really good, right? Same with appointment to doctors. In Israel, sometimes you can wait for really long time to see a doctor, a general practitioner, for example. This is quite the opposite in Czech Republic. And I think that it happens in Israel because we don't have enough spaces for doctors. We have students. Those students finish their medical studies, then they come either back to Israel, those who studied abroad, and they're waiting for spaces, and there are no spaces, unfortunately. Yeah. And this is not a problem in the Czech Republic. Here, I could find a job quite fast.
You're now in your first year of medical oncology residency. How is the experience so far? Do you like it?
I do like it, although it is quite challenging. Again, because of this language barrier. No matter what will I do, I will never become a Czech person, right? I'm still the same. But I'm doing my best. I'm taking language courses to improve my language. And overall, it's quite interesting. I'm working now at the inpatient department, and we're treating patients after chemotherapy, after radiation therapy, immunotherapies, etc. And we have a lot of patients with adverse events. There can be like post-chemotherapy adverse reactions or immune-related adverse events. And for both of those kinds of patients, we have to give the best treatment we can. And it's quite difficult sometimes because we should really think about it that we do not treat a disease, we treat a patient, we treat a person. So it should be very emotional. We should describe everything because the patients are sometimes very scared. They don't know what they're going to face, right? I mean, last week I had a patient who came for radiotherapy and she didn't know what is it. So I had to show her some YouTube video. You remember that? And she was more calm about it, more positive about it. So it's really about communication. It's an art, I would say.
Today in the morning I was watching a video on social media, like it was say, it doesn't matter what kind it was. If I'm not mistaken, it was in Germany. Like it doesn't matter what kind of patient you have. They're giving like you 15 minutes for each patient, and like for cancer patients, like it's really difficult to tell everything about their disease to the patient in 15 minutes. And the girl was saying like they know the disease, but they really don't know what's going on with them. So for cancer patients, it's really important, like to give the information, like to explain everything thoroughly, so patient know what's going on. Like it's really difficult for them, like to get the diagnosis, and they don't know what's going to happen next. And it's really important to have good communications with them.
Exactly, and especially in those palliative patients, because I saw some doctors who are just coming to the patient's room and just spilling this information that the patient is going to die, and then the patient is in shock, basically. I'm trying to develop my own my own way of telling such things to patients. And we're working together closely with psychologists. So those patients do not tolerate this information by themselves. Otherwise, it could be very difficult.
It would be very difficult. So it's really great the job you are doing there. So Philip, you also teach oncology to students. How has that shaped how you see yourself as a future doctor?
So in our department, it is a must to teach, especially at the first year of residency. But most of us are continuing to do so during the whole residency and even further. I really like teaching. I think that a good teacher creates a good doctor, right? Because we all started as students and we were eagering for this good teaching, this good education. And that's why I'm trying to involve the students as much as I can and to create some new interactive ways of teaching. I'm teaching currently the topic of acute conditions in oncology. So I'm giving them clinical cases. You also saw a few of them. That are quite interesting. And the students are trying to come up with ideas of what is the differential diagnosis, why do they think so, and what are the treatment possibilities. And of course, after them, we discuss it together. So it's really nice, and I really like it. I would like to continue with it for sure.
That's great. Like it's very important for to make students to think like a doctor, and like solving this case really helps. It's helping me a lot, in fact. So I guess it's also the same for other students.
Exactly, because I remember that when I was a student, we had those lectures when the lecturer was just sitting and talking for hours, and nothing really gets inside our brains, right? It's better when you can participate by yourself and think about those cases.
Like you have the information, but you don't know how to like use it. It's really different. Yeah, Philip, I'd love to talk about doing research during residency. How important do you think it is, and what are the real challenges of balancing it with clinical work? And are there actually opportunities out there, or you have to actively create them by yourself?
So it really depends on the place, because in our university, in Palatsk University, we have the possibility to conduct research. We have a program which is called SWOT, and there is a list of scholars, of researchers, and every student can join if he likes. It's really not a problem. But sometimes we do have to seek for those opportunities because I don't want a small research, a small scale research. I want it to be something bigger. I wanted since fourth year to publish some articles. So I found a really good teacher. She was my pathology teacher. And since then, we're together publishing articles, conducting research. I really like it. I think that research is what develops medicine.
Yeah.
It's not just my thought, it's a real thing. Without it, we wouldn't do a lot, right? Not in oncology, not anywhere. So I think that a doctor who is not conducting research, I can't say he's not a good doctor, but it's not enough.
Yeah.
Okay? I have been always told that a good doctor should do three things: to do the clinical part, teach, and do research. These are the three pillars. This is what I believe. And about how can we do it? Well, as a student, it's a bit difficult because you don't really have time. So I was working sometimes at nights or during the weekend. But everything is possible if you just know how to work with your schedule.
Yes, I guess research is the one of the cornerstones of medicine, especially in oncology, because in oncology everything like develops very fast, and you have to catch up to know the modern techniques and therapies. It's really important to be in research, or at least know techniques how you can like deal with that research paper. Like it's really important if you want to like be a good doctor and know the modern therapies and approaches to cancer. So you are also doing PhD. You are going to finish your first year soon. Can you tell more about your PhD, or it's confidential?
I could tell just a few things. First of all, about PhD, I can really recommend doing it. Like it's up to you if you have the time for it or not. But it gives you more things to do, right? More interesting things to life. Our PhD is under the Department of Pathology, and it is about novel biomarkers of prostate cancer. And we already found some molecule. I'm not going to talk about it. We'll talk about it in another time after I publish it.
Yeah, we're going to have another.
Exactly. But basically, we're trying also to change the tumor microenvironment so the prostate cancer will be less immunologically cold, what we call it, because it doesn't really work with immunotherapy, unfortunately. So this is about the PhD. I think that if you want to do a PhD, the most important thing is to find the best scholar. Yeah. The one that will have time for you, that will have time and will to check your manuscripts, your articles that you are writing, to give you the pathway of how to do your work. Because at the beginning, we don't really know how to conduct a laboratory work. We don't really know how to write. So we need to get those skills, and you get it by time. That's for sure.
So yes, it's important to have someone who will guide you. Like we are talking about this almost in every episode of OnCoffee. Like someone has a mentor. All of them has a mentors. Like a good mentor is really important to lead you, to teach you, to show you things. So it's really important.
Exactly, and I think that I am very lucky to have my mentor, Dr. Koreshvili from pathology. Yeah.
Yeah, that's really impressive to like do PhD and clinical training together. Like you have to dedicate so much time to both of them, so it can be really challenging. And I'm happy that you can like manage it, all of that. So, Philip, let's switch gears. What do you enjoy doing when you are not working? I know you're into movies, reading, tennis also. So, can you please share more about that?
Since 8th grade, I think, I started to play tennis, and I was quite good at it. Got also some medals, and I'm still playing with my friends, especially on weekends. I like going to the gym, swimming, because it's impossible to sit the whole day. Our work as oncologists is an office work. We sit a lot. So we have to do some other stuff as well. I also like to go to movies. Here in Olomouc, we have a really nice theater, and also to operas. About books, yeah, I read a lot. I read a lot, especially in Hebrew, some in English. I'm trying to read also in Czech. It's still a bit difficult for me, but I'm getting it.
Okay. So, can we have 3 book and 3 movie recommendations from you?
Of course, of course. Actually, I have them here. So the
Okay.
first one is this one, Caravaggio in Rome.
Oh, yeah.
It's like a historical book about his paintings. I was in Rome last year in a congress, and I went to this museum, bought the book. It's quite interesting. So this is the first one. Then it's in Czech, but Harry Potter,
Yeah, I love it.
because yeah, I have to start with something which is a bit easy for me. I still can't read those difficult books in Czech.
Yeah.
And the third one is this,
The
the Krakow Ghetto Pharmacy by Tadeusz Pankiewicz. It's quite interesting because it emphasizes this person, Tadeusz Pankiewicz, who saved a lot of Jews during World War II. He was a pharmacist, so a healthcare provider, basically, like us. And it's really nice.
That's
He
great.
was a hero.
Yeah.
And about movies, so science fiction, basically. Lord of the Rings,
Yeah.
Harry Potter, all of them. Also, this Fantastic Beasts was quite good.
Yeah.
And Schindler's List.
Like two really different like especially science fiction, and then comes Schindler's List. So really
Exactly.
interesting.
A contrast.
Yeah. Yeah, it was really interesting. I will ask you the names of the books later so I can also read them because I won't remember. So like, yes, very important to have something outside of clinic and research, like to relax, to chill. It's very important, and like it gives you energy, like it's recharge you for the upcoming clinical training and research. Philip, what's next for you? Whether it's in oncology, research, or life more broadly, like where do you see yourself in some years?
Yeah, so I'm definitely thinking about staying in the Czech Republic because it's a great place. And but I definitely think about continuing to some fellowship in the United States or in the UK. I hope so. Because I really want to see other perspectives on oncology, other point of views, not just in the Czech Republic, but in other places as well. And I want to continue with my research. I think that research should never stop. So even after I finish my PhD, I will continue with this. It will be quite interesting, I hope. More articles to publish.
Yeah, I'm excited to see where your journey goes. Like, it feels like you're just in the beginning, and I hope you're gonna achieve two great things. So, Philip, thanks again for joining me and for everything you shared. It's been great learning from you in the hospital and now in this conversation. And to everyone listening, thanks for tuning in to OnCoffee. We'll see you next time. Stay curious, stay grounded, and as always, keep the coffee brewing. Bye-bye.